Welcome back. Kristen is sticking around to talk with us about cardiac rehab. Kristen, thanks again for being here.
Thank you.
Yes. So let's talk about cardiac rehab. What exactly is cardiac rehab?
Cardiac rehab is an outpatient service, and it's for people who have had some sort of cardiac event or surgery. It's a supervised exercise, and we do also education. A lot of times people aren't in the habit of exercise, so we always start really low workload and small amount of time, and then just increase those things as people can tolerate them.
Excellent. So let's talk about who prime candidates might be for cardiac rehab then.
Sure. So people who've had heart surgery or heart attack, who also people with heart failure are also candidates, and heart transplants too can come.
Okay. Can you get into what the primary benefits then, in detail
Sure.
are for folks who have had one of these situations arise, and what benefits will they see from getting cardiac rehab?
Well, there's two parts. The first one is exercise, because exercise is so important in leading a healthy lifestyle. There's a lot of benefits to exercise. Helps you sleep, helps your immunity, helps with depression and anxiety, also lowers your blood pressure and your cholesterol, weight loss, and all those benefits. It's really, there's numerous benefits to exercise. So that's one thing and having a sedentary lifestyle is one of those risk factors for developing cardiovascular disease. We also focus on education, which is primarily focused on reducing risk factors for cardiovascular disease. So it's a secondary prevention program where we're teaching people, now that you've had this event, now we're going to teach you to make some lifestyle changes. So you'll decrease your chance of having another event, and if you do have another event, then you'll have more of a chance of surviving that.
Okay. So why is it important then for folks to work with specialists in terms of cardiac rehab?
Well, it's because of the education, and it's a motivation for people to come and actually have an appointment to be able to change those lifestyle, modify those lifestyle risk factors. There's also a social aspect to it. So because everybody who is there has some sort of heart or lung problem, and so there's a huge social aspect of that and social support. Also, people don't always. There's some fear after I've had a heart attack, now I'm not sure what I can do, what's safe to do. And so we do a lot of education for teaching people what are their limits, knowing their body, what they need to listen for. And also people, because they may not have symptoms when they're out exercising on their own, we can, because we're checking their blood pressure and they're on a heart monitor, we can often see things before things come up. So
cool.
Yeah,
that kind of leads into the next question, and that is it dangerous for someone to create their own cardiac, basically their own exercise routine after they've had a cardiac event like that?
It can be dangerous because, like I said, people don't always have symptoms that they recognize. They don't know if their blood pressure is responding in a healthy way to exercise, or if they're having a heart arrhythmia. And people generally are not used to exercising, so if they've had a sedentary lifestyle before their event, then this is really good. And even for people who have had a regular physical aerobic exercise program, it's very good because of not necessarily having symptoms and having potentially dangerous events afterwards.
So I understand there are different phases of cardiac rehab. Can you talk about those?
There's 3 different phases. The first phase is usually done in the hospital with the physical therapist. So the physical therapist will come and get the person out of bed and walk down the hall. The second phase is more the outpatient acute phase, and that's what we do. So you'll be put on a heart monitor, and your heart rate and rhythm will be monitored, and blood pressure and all that, along with the education. So that's phase 2. And that usually takes anywhere from 12, usually insurances will cover 30 to 36 visits, but it can take 3 to 4 months depending on how often you come.
Wow.
If you come 2 or 3 times a week.
Wow, so education is a big part of cardiac rehab then?
Definitely, yes. Yeah, because we're educating on the risk factors for heart disease, and so education's a huge factor, a huge part of that, yeah.
And you mentioned insurance just a minute ago. Do most insurance carriers cover cardiac rehabilitation?
They do, yes. Most insurances, Medicare covers 36 visits usually, so that's 3 to 4 months, and other private insurances as well cover, similar to what Medicare does.
Excellent. So if someone's undergoing cardiac rehabilitation, are there words of wisdom that you would share with them?
Don't be afraid. It's a great program, and making changes in your life, we live most of our lives with these unhealthy habits, so it can be difficult to make those changes, but do it for yourself. Think of it as an investment in your future, for having a healthier future, being more quality of life, being able to do things with more energy and with more ease. Also, as we age, we tend to, as you age, you're going to be more likely to be independent at an older age. So that's very important for quality of life.
Excellent. And then one last thing I wanted to ask really quickly, and that is, how does someone get into cardiac rehab? Is that a referral from their specialist? Is that typically the path?
Usually a cardiologist or a cardiac surgeon or your primary care physician may also refer you.
Okay. Kristen, thank you so much. It's been enlightening. It's been a pleasure having you today, and I know our viewers will really appreciate the information.
Thank you. Thank you for having me.
Thank you. I'd also like to thank Britt for being here today as well. We'll see you soon. We hope you stay fit, stay well, and stay healthy with Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.